The aim of the Norwegian Brief Outpatient Rehabilitation Programme is to help people recover from the post-COVID condition. This is sometimes called long COVID, and it's where symptoms continue for months or even years after the initial infection. The World Health Organization suggests that there are 22 million people worldwide who still have symptoms a year after the infection. Here we hear from a patient who tells us what it's like.
After COVID, I experienced chest pain, brain fog, and I was nervous. Even if I was just sitting and relaxing, I felt nervousness. And I had irregular heartbeats, and I was exhausted very much of the time. And the symptoms got worse after activity. And this led to me being more and more isolated from my normal life. And I was afraid of getting even more symptoms and that my life would be like this forever.
People with the post-COVID condition can describe symptoms as common and very frightening. Doctors are often not able to provide an explanation for the symptoms. Patients then become fearful, and this can make the symptoms worse. They desperately seek relief from a variety of often untested treatments. And here our patient tells us about some of the things that she tried.
I tried a lot of different strategies to get well. I rested, avoided activity, took vitamins, minerals, and even allergy medication. Nothing seemed to help, and I was getting worse and worse, and even more isolated. Then I met the people at Kysthospitalet. They gave me a reasonable explanation for my symptoms, and most of all, they assured me that I couldn't do anything wrong. This was just my body being on the wrong track, and the body had to learn that activity could not harm. I was desperate to get well, and I chose to trust the advice.
The Norwegian Brief Outpatient Rehabilitation Programme aims to explain the symptoms and to help patients find routes to recovery. Here, the lead researcher describes the programme.
The Norwegian Brief Outpatient Rehabilitation Program is really all about giving an explanation for the bothersome and unpredictable symptoms. Independent of activity, symptoms are viewed as natural after an infection, but they will vary. And working with the patients, we aim to foster a belief that recovery is possible and that the disorder itself is treatable. But recovery would require an active pursuit of physical and mental tasks. So together with the patients and through homework, we actively explore new activities that are individualized, suitable, feasible, and enjoyable over time.
The Norwegian Brief Outpatient Rehabilitation Programme is based on decades of experience in this group in treating people with post-viral conditions. It's based on the cognitive activation theory of stress, which means that it draws on neuroscience research that the causes of the condition relate to evolved brain systems designed to protect us from danger, which can sometimes go awry. The programme is delivered by physicians and physiotherapists trained in cognitive and behavioural approaches to recovery. Turning back to the patient that we met earlier, in her first consultation, she said that she missed her choir. So she agreed that returning to the choir would be the first step to recovery and part of her homework.
I started with one activity, singing in the choir, and I gave it my very best. The positive effect of not focusing on the symptoms made me try the same strategy in my everyday life. And it turned out to work just like I was told. Today, my symptoms are gone, I'm working full time, and I haven't thought of COVID or long COVID for a very long time.
This programme has been tested in a randomized controlled trial. This is a reliable research approach where people with the post-COVID condition are allocated at random to the Norwegian brief outpatient rehabilitation programme or to standard care. At set points after, the patient's health is measured. This will include measuring fatigue, other symptoms, and the ability to return to work. Here, Tom, the lead scientist and doctor, describes the results.
The results of the trial was great. The intervention was effective and safe, with sustained better physical function and less symptoms. Interestingly, people with kickbacks and post-exertional malaise showed even larger beneficial effects of the intervention.
The results are consistent with a recent systematic review on this topic, as well as our broader knowledge base. Here we ask Professor Flottorp, senior researcher and general practitioner, on her views of this trial.
I think this is an excellent and very interesting study, and I think it's actually the results are not really surprising, given what we know from the systematic review on interventions to treat patients with post-COVID conditions or long COVID, but also what we know about the evidence on similar conditions, post-infectious conditions, and in particular for patients with chronic fatigue syndrome or ME. So it's a very good study, and it fits into the evidence. It's not surprising.
The Norwegian brief outpatient rehabilitation programme for the post-COVID condition. This programme is effective and safe, and such interventions need integrating into routine care.
Definitely, I think that this intervention should be used and that this knowledge should be spread to general practitioners and patients suffering from post-COVID condition. It's a brief, actually, treatment. It doesn't take much resources, and it's possible to recover. That's, I think, a very important message to put forward to health professionals and to the patients.